Hey there, friends, and welcome to Lunchtime Live with the Center, where we talk about important fertility topics and answer your questions as well. My name is Emmy Choksey, and I'm your host. Now, if you're trying to conceive, every month that goes by without a positive pregnancy test can feel like an eternity. So today we're talking to Dr. John Nulsen, who has been with the Center for Egg Program. He'll be talking to us about when to consider seeing a fertility specialist. Welcome, Dr. Nulsen.
Thanks. And folks, I hope to be informative for you, but please don't hesitate to ask questions. I mean, the main focus is to be available to you and to try and answer, any questions you might have. So I welcome any questions you have.
Oh, awesome. Dr. Nulsen, can you talk to us a little bit about what a diagnosis of infertility is?
All right, so let's chat about that. So it depends to some extent on age, all right? So in a woman who's 35 or less, infertility is defined as a couple who's been having appropriately timed intercourse for the past 12 months and unfortunately has been unsuccessful in conceiving. That changes as a female ages. So in women greater than 35, we shorten that till 6 months. So over 35, any couple who's been trying to conceive for 6 months or more, who's been unsuccessful, and they've had regular, appropriately timed mid-cycle intercourse, perhaps by using an app on your phone, or even better, using one of the over-the-counter ovulation predictor kits. If you failed to conceive, then that would be defined as infertility as well.
Okay. Now, is this something that someone's OB, their gynecologist may diagnose, or is this something that they would see a fertility specialist about to get that type of diagnosis?
So certainly most OBGYNs are absolutely qualified to make that diagnosis. I think the question becomes, who's the most important person to evaluate and treat the infertility once it's been diagnosed? As a female ages, because age has such a profound influence on a female's ability to conceive, I think it's reasonable that in any female who's 35 or greater, and again, because time is so precious, that they get sent right away to an infertility specialist such as us. Less than 35, I think it's totally appropriate for the general OBGYN to do the evaluation and maybe start with simple forms of treatment. But I think as a female ages, it's really important that they get in the hands of a reproductive endocrinologist sooner rather than later, just because time becomes of the essence.
So what is the likelihood for a woman to be able to get pregnant after 35?
Well, let's look at it from the beginning. So clearly, as a female ages, unfortunately, a couple things happen. Not only does her ability to conceive decrease, but her likelihood of having a miscarriage increases. So if you look at a young female in her early 20s in any given month, should she have appropriately timed intercourse, her likelihood of conceiving, may be as high as 20 to 25%. At 30, it's probably 15 to 20%. This is in any given month. And at 35, 10 to 15%. At 40, 8 to 10%. And by the time you get to 43, 44, it's at best 5 to 8%. The other thing that unfortunately changes is that as a female ages, the risk of miscarriage goes up significantly. So in your early 20s, you get pregnant, your risk of miscarriage, is 15% or less. If you look at a 42, 43-year-old who conceives, unfortunately, her miscarriage rate may be as high as 40 to 50%.
Okay. Now, why does it decrease?
That's a great question. So it's sort of a confusing concept, but to simplify it, it's because as a female ages, and it's purely related to maternal age, not paternal age, the percentage of embryos that are created either naturally or through IVF, an increasing number of them have an abnormal number of chromosomes present. They're missing a chromosome, or they have an extra chromosome. Mm-hmm. And what happens to those embryos is typically they don't implant, or if they do implant, there's an increased risk of miscarriage. So you can totally explain the decreased ability to conceive as a female ages, and the increased likelihood of miscarriage to an increasing incidence of an embryo being abnormal, either spontaneously conceived or through IVF. And just to give you an example of that, so Down syndrome, that's actually an extra copy of chromosome 21. So it's what we refer to as trisomy 21. The incidence of that at 35 is 1 in 300. At 40, it's 1 in 100. At 45, it's 1 in 33. But that's just one of many chromosomes that can be involved in what we call aneuploidy, meaning there's a missing chromosome or there's an extra chromosome.
Now, you said that the number of eggs decreases as you age. Is that correct? Can a woman's body generate new eggs?
No, unfortunately, unlike males, a female is born with all the eggs she'll ever have. It's kind of a scary concept. When you're born, you have probably over 300,000 eggs, all right? But as you age, every month, you're losing eggs, all right? Males continually reproduce or make more sperm. So that doesn't change with advancing male age, but the number of remaining eggs that a female has absolutely reduce with increasing maternal age.
Okay. Now, you've been with the center for 30 years. What trends have you noticed with regards to the patients when it comes to, well, with anything, but including age?
Well, clearly, since I first started doing this a couple of years ago, the age at which we see patients presenting to us is increasing. And certainly there are a lot of good reasons for that. You know, certainly over 30 years, more and more women are deciding to have their own professional careers, which is great. You know, more and more of them have goals they want to obtain in terms of their professional career. Maybe that be further education, to get their master's, to get their doctorate, or goals they want to achieve at work themselves. So they have chosen for those reasons to postpone having children. If you look, there's data from the early 70s, and then this data is repeated in the early 90s. The percentage of women who are attempting to have their first child over the age of 35 has increased dramatically. That's good and bad. It's good for their careers, but unfortunately, as when we just shared the data, as the female ages, her ability to have a successful pregnancy decreases. So no one would discourage a female from fulfilling her career, but I think it's really important that you have to be aware of, you know, what the implications are. It does come with some expense in terms of the ability to be able to successfully conceive and carry a pregnancy to term.
So what are some of the other reasons someone should see a fertility specialist beyond just age?
Well, certainly if there has been identified, regardless of age, if there has been identified an etiology for their infertility. So for example, if the spouse, the male partner, has been identified to have an abnormal sperm count, low sperm count, those sort of issues, that would be a reason to be seen earlier rather than later, because their likelihood of conceiving is decreased. If a female is at risk for infertility, so for example, and perhaps we'll chat about this a little bit later, but if she's been diagnosed by her OBGYN, for example, and she has evidence of what we call diminished ovarian reserve, so her ovarian function to some degree is reversed. Unfortunately, that's only going to worsen as she ages. So that's a reason to potentially seek care at a younger age. If a female has been diagnosed at whatever age, at some condition that's going to make it difficult for her to conceive. Let's say she's unfortunately been diagnosed with, severe endometriosis. Endometriosis is significantly going to impair her ability to conceive. She certainly should be seen regardless of age at right away, or if unfortunately for whatever reason, if a female has been diagnosed with tubal disease, she's had a pelvic infection or bad endometriosis, age isn't a factor there. The fact of the matter is she's unlikely to conceive on her own regardless of her age, and so she should be seen earlier as well.
And you mentioned diminished ovarian reserve. How many do you see this a lot, and how often does this, or what causes this?
So that's a great question. So just to explain what that means, diminished ovarian reserve, a simple way to look at it is how many eggs do you have remaining, all right? And there are a number of parameters that we can look at to assess that. So one is to look at your reproductive hormones on cycle day 3. So we look at your FSH, we look at your LH, we look at your estrogen, all right? Another hormone we can look at, which is cycle independent, it can be drawn at any time during the cycle. It's called anti-Müllerian hormone. That's another good marker of ovarian function. And then finally, probably the most helpful and most sensitive is to do a transvaginal ultrasound and actually look at your ovaries to see what are the number, see what the volume of the ovaries are, and to see what you refer to as your preantral follicle count is. That's the number of follicles that are less than 10 millimeters in size. When we look at all those parameters, we can get, in some sense, a much better sense of what the health of your ovaries are. And if it's inappropriate certainly for your age, then that's a suggestion that, yeah, probably proceeding forward with treatment sooner rather than later is a good idea.
Now, do you also see men who have, is there any impact of age with male fertility?
That's a great question. So when you look at males, certainly as a male ages, sperm parameters do decrease, but they don't fall out of the normal range. All right. So you may see that a male's count may decrease somewhat, motility may decrease somewhat, but in general, they stay in normal ranges. So as males age, the ability of them to produce a successful pregnancy really doesn't decrease. The only thing that we're aware of is that when males enter for example, their 50s and 60s, there is some evidence. It's very, very small increase, but there's a very, very small suggestion that it may increase the risk of autism in the offspring.
Okay.
But that's in males who are, 50s, 60s, much, much older than I am.
Okay. And, when someone wants to come to the center or has been trying for 6 to 12 months, do they need a referral from an OB or another doctor to come to the center?
No, absolutely. Someone does not need a referral. I mean, the majority of patients that we see are referred by their general OB/GYN, or in some cases by their family practitioner or their general practitioner. But absolutely, no, you don't have to be referred by another physician to see us. If it's something that you're concerned about, then absolutely, you can make an appointment on your own. You don't have to be referred by someone else.
Okay. And for those people who are referred, how do we communicate with their referring physician, the OBs that typically the gynecologist that has referred the patient to us?
Right. So sometimes it's really helpful in advance, and we do this in all cases, to reach out to the referring OB/GYN, because on many occasions, the general OB/GYN has already done or initiated part of their workup. And that's really helpful because it saves time, and it also may serve to direct us in terms of what direction we go to and further testing. As a center, we feel that it's really important to stay in close communication with our referring physicians. So whenever one of us sees a new patient, we dictate a note describing our visit, But in addition to that, we always send a note to the referring physician so that they will be kept in the loop. And then during treatment, if there are any significant changes in what we do, or when we come up with a treatment plan, we try and keep them in the loop by sending them a note. And then, once we're hopefully successful in having someone get pregnant, then we send a follow-up letter so they know exactly how the patient conceived, what treatment modalities were utilized, when are they expected to conceive, and if there's any special things we think the general OBGYN should be on the lookout in terms of the pregnancy. For example, one thing that's been associated with difficulties in pregnancy is thyroid dysfunction. So if we diagnose a patient as having an underactive thyroid and we place them on thyroid replacement therapy, we'll share that with the OBGYN and say, hey, during the pregnancy, you need to follow your patient's thyroid function very closely. Here's the current dose they're on, and here's the level of their TSH, the hormone that we monitor for hypothyroidism. Here's what we recommend that you maintain that level at throughout the gestation to try and ensure a healthy pregnancy.
Okay. So if someone is under 35, the recommendation is 6 months, and if they're over 35, it's 12 months. Sorry, the other way around.
Yeah.
So if they're under 35, the recommendation is a year. If they're over 35, the recommendation is to come see a specialist after 6 months, correct?
Correct.
Okay. So, and if there are and then there are some medical reasons as well that could suggest coming to a fertility specialist.
Right. I mean, there could be a number of factors that, regardless of age, would say, no need to wait. Come see us right away, which I sort of went, low, very low sperm counts or no sperm, or, evidence of decreased ovarian function. If someone is not getting periods on a regular basis, and they're not ovulating, obviously they can't get pregnant spontaneously. So if they're not under the care of their general OB/GYN for that individual should see us right away, because if you're not getting regular cycles and you're not ovulating, you're not going to get pregnant on your own.
Okay. So I'm going to switch it over a little bit. Can I ask you a few personal questions?
Maybe.
Okay. What are your favorite pizza toppings?
Well, I have to admit that I'm not the healthiest person when it comes to that. But as of COVID, my daughter and son-in-law have been living with us since March, and my son-in-law and I both love pizza. And our favorite toppings are not very healthful, but mushrooms and sausage. Sometimes pepperoni, but primarily mushroom and sausage.
I love that too. So coffee or tea?
Coffee, but only decaf. I do have one major weakness that you should all stay away from, because it's absolutely not good for your health. I don't know if you can see this, but it's Diet Coke. I have to admit that's one of my weaknesses. I'm trying not to drink it, but I'm having a hard time with that.
Okay. What do you like to do outside of work? What's your favorite hobby pastime?
Well, spending time with my family is probably one of the most important things. Spending time with friends. But I'm really a big fan of outdoor activities. Kind of crazy, but I have a group of friends. Every Monday night, we go mountain bike riding. As we get older, we do less and less challenging rides. But I love to do that. Love to go mountain climbing. I have another group of friends that at least once or twice a year we go up to the White Mountains and go mountain climbing. I love to ski. Unfortunately, with climate change, snow is becoming not as prevalent, but I love to do that. Love to take nice jogs, nice walks, and love to bicycle ride.
Excellent. And
I should mention one thing too. I love to read, but this will give you an idea as to how successful I am with it. Typically, I accomplish reading one book a year.
Okay.
So not very good with that.
I love reading, but I don't I listen to my books, so that helps
Well,
me.
I
Yeah.
should start doing that.
Yeah. What is the best piece of advice you've ever received or you've received?
Well, probably one of the best pieces of advice I received was long, long time ago, but was from my father, which um, he always used to say. I had four siblings as well. He always used to say to us, never underestimate yourself and what you can do. Um, Always reach for the stars. All right. There's no crime in failing, but if you don't try, you'll never understand the heights that you can reach. So that's something I've tried to uh, teach to my children as well. Is always push yourself to try and be as good as you can, and to try and achieve as much as you can, both in your professional life and in your personal life. Don't be afraid of failing. You'll never know unless you try.
That's great advice. I'm just going to look at the questions real quick. So we have some comments. Want to say thank you for everything you did for my husband and I to be able to have our little guy. Hopefully, I can bring him in for a meet and greet soon.
Love to do that.
Next, thanks to all the staff and Dr. Nulsen. Without them, we would not be expecting our twins. Thank you. And don't feel bad. I haven't read anything in more than a children's book in years.
Meg, I love that. I love that comment. Thanks for that one.
Yeah. All right. Dr. Nelson, thanks so much for joining us. One more thing. My husband and I will be forever grateful for you and your staff. Our miracle, Hannah, is 14 and a half. That's great. And the joy of our lives.
One of the things I'd like to stress, and I know most of our patients clearly know this, the physicians would not be as successful as we are if we were not surrounded by such an amazing staff, whether that be our nurses, our medical assistants, our front desk people, our financial service representatives, the people who work in our IVF lab, the people who work in our andrology lab. Well, not so much for the nurses, but these are people behind the scenes that you frequently don't see. But they are really the ones who deserve the praise. They're the ones that make this happen on a daily basis. And I always think about whenever I have a successful patient who conceives, there was a huge team behind me that facilitated this process and made it happen. So I just want to say kudos for all the great staff that work with us and make what we do possible on an everyday basis.
It's really a team effort for sure. So thank you so much for joining us today, Dr. Nelson. It was a pleasure speaking to you, and we'll be back next week for another lunchtime. Information as well as a calendar of events to support you and to help you feel connected. So see you next week.
And I really appreciate the time to chat with you folks.